Good morning, everybody. My name is Brandon Labarge. I'm an ENT resident from Penn State. The title of my talk is Optical Mapping with Genome Imaging Identifies the Structure of Human Papillomavirus Genomes of Head and Neck Cancers. I'll begin with some background about HPV, then I'll discuss the role of HPV in head and neck cancers. I'll go over our experimental design and implications. I'll provide an overview of bio-nano optical mapping with genome imaging. I'll then compare that to whole genome sequencing with Illumina, and then I'll discuss our results and conclusions. Human papillomavirus, HPV, is a double-stranded circular DNA virus, approximately 8 kb in size. It has two very important genes, E6 and E7, which encode for viral oncoproteins, which disrupt P53 and RB, and are thought to be central for HPV's role in cancer development. There are multiple subtypes of HPV that are implicated in head and neck cancers. Greater than 80% are HPV-16, although a smaller proportion are other subtypes like HPV-33. If we can compare classic squamous cell carcinoma of the head and neck to HPV-induced squamous cell carcinoma, we'd see a number of differences. The classic form typically is elderly males, strongly associated with traditional risk factors like smoking and alcohol. These cancers tend to have high mortality, which is some sensitivity to chemoradiation. The HPV-induced squamous cell carcinomas are typically younger males, and of course associated with HPV as a major risk factor. The tissue type for HPV tends to be lymphoid tissue, so tonsils and base of tongue in this region. The mortality is lower and usually have higher sensitivity to chemoradiation. Most head and neck cancers in the United States have been decreasing in recent years due to a reduction in smoking rates in the United States. However, oropharyngeal cancer is one of these subtypes of head and neck cancer that has been increasing. This is really being driven by HPV. As you can see in the blue line, HPV-positive oropharyngeal cancer has been increasing, and that has continued in recent years, and that's been driving the overall increase shown in yellow. The black line shows HPV-negative oropharyngeal cancer incidence, which has been decreasing. And so what we're seeing really is a risk factor shift for this cancer away from smoking alcohol to HPV. And oropharyngeal cancer is essentially the middle region of the throat, so again, tonsils and base of tongue. HPV is thought to exist as three main forms. It can be integrated into the human genome, or it can exist outside of the human genome as a ring of DNA, which we refer to as episomal. It can also be thought to be a viral human hybrid episome as well. Most of what we know about HPV comes from cervical cancer, where greater than 80% of these HPV cancers are integrated. And so we know a lot less about these episomal forms. It's thought that for head and neck cancer, approximately 50% of these HPV cancers are integrated and 50% are episomal. And so again, we know a lot less about this situation. It's theorized that integration of HPV into the human genome disrupts viral E1 and E2. And this is important because E2 is a viral repressor for E6 and E7, which again encode for viral oncoproteins. And so therefore the integrated form has increased E6, E7, and thought to be associated with increased genomic instability and cancer formation. Our research goal was to combine optical mapping with genome imaging from bio-nano and whole genome sequencing from Illumina to characterize the molecular state of HPV in head and neck cancer. The implication of our research is to develop a platform to identify and describe the molecular states of HPV and head and neck cancer and associate these with patient outcomes. So the goal is to one day be able to tailor our treatments so that patients who are at low risk for recurrence and have less aggressive HPV can get less aggressive treatment, and those with more aggressive cancer types can get more aggressive treatment. So an overview of bio-nano optical mapping with genome imaging. The process starts with isolation of high molecular weight DNA, so this is at least 150,000 base pair in length. And this is done using an SP or a solution phase kit, using a nanobind disk to bind the DNA. It takes approximately 4 hours. The DNA is then labeled with a specific sequence across the entire genome, so this is a direct label staining DLS. This is a 6 base pair sequence that's stained, and it kind of creates a molecular barcode for the DNA. The DNA is then loaded onto one of these sapphire chips, where it is linearized and then imaged by the sapphire instrument shown on the bottom left. The sapphire takes repeated image cycling of this to generate digital molecules that an algorithm can convert, and then these molecules are assembled based on overlap to form these consensus genome maps. Once you have these genome maps, which you shown in blue, you can compare it to a reference. So for human, like the HG38 reference, which has also been labeled with the same enzyme. And then you can detect structural variations like insertions, deletions, and translocations by comparing the reference to your genome. This is a closer look at the Sapphire chip and how the linearization process of the DNA works. So the DNA becomes untangled into pillars and then passes into these very narrow channels. When the Sapphire instrument is running, this is the type of data that you see. So you have these very long strands of DNA stained in blue, and there's a green staining, that's the direct label stain, the 6 base pair specific sequence as it passes through. And DNA passes through over and over for repeated cycling. The digital molecules look like this, and the overlap of the labeling then allows you to create a genome map shown in blue for your source material, so for us, usually cancer. And then the HG38 reference here shown in green. They're both stained with the direct label enzyme, and so then you can compare your genome map to the reference to describe any structural variants. So if we compare the Bionano platform to whole genome sequencing, we can see that whole genome sequencing is better at detecting small mutations. However, optical mapping with genome imaging from Bionano is better at detecting large and complex structural variations. And so for our research, we utilize both because they have their own benefits. So now I'll go through a couple real patient examples. So this is a base of tongue cancer. This is a visualization of the Bionano data. It's called a Circos plot. And so you can see the chromosomes are labeled 1 through 24 on the outside. Beneath that is a chromosomal banding pattern. The different structural variations, so the insertions, deletions, translocations, are color-coded. And so insertions show up as green circles. You can see one on chromosome 23. Beneath that is where copy number variation is generated, and then in the center are the translocations. We also filter all our cancer samples by patient-matched blood to remove any germline mutations. So what we're seeing are just somatic mutations present in the cancer. So this patient has a fair number of structural variations in their cancer, including a number of translocations. If you look at the whole genome sequencing for this cancer sample, it in fact maps to the HPV33 reference. And it maps fairly well except for this region in the center that's been circled by a red circle here, where there's a lack of mapping to the HPV33 reference. And we actually detect chimeric reads, so reads from sequencing that have both human and viral DNA. And so this reveals to us an integration site for the virus. If we then take those coordinates of the integration site from whole genome sequencing and find the relevant structural variation in Bionano, we can see what this event actually looks like. So in chromosome 15, we can see that HPV33 inserted itself into the genome. So again, the tumor genome map shown in blue compared to the reference in green. HPV has inserted itself into the region here, and then there's a duplication event of the virus and the surrounding region of the genome to create a new segment. And so by combining whole genome sequencing with Bionano, we're able to describe this type of event in high detail. The same patient had a translocation disrupting the retinoblastoma gene. You can see a deletion of part of the retinoblastoma gene on chromosome 13 that was inserted on chromosome 6. The second patient is a tonsil cancer patient. On the Bionano, we can see that there's essentially no structural variance for either the tumor or the lymph node for this patient. If you look at the whole genome sequencing, this maps to HPV16 reference. And we can see good mapping overall, except for a region denoted within the arrows of some decreased mapping, but we don't detect any chimeric reads. And so this indicates that this is not integrated into the genome, and so this would be more consistent with an episomal form of HPV. Third patient here, again tonsil cancer. This time there's a fair number of structural variants shown on the Circos plot from Bionano data. I'm including a number of structural variants on chromosome 14 in a similar location on the chromosome. So we're seeing an insertion, a deletion, and a duplication in a very small area. If we look at the whole genome sequencing for this patient, we can see that there's some pretty stark decreased mapping to the HPV16 reference in a region that corresponds to E1 of the virus. And these, in the areas that's denoted by the arrows, actually matches up with where the integration site for the virus is into the genome, human genome. And so what we're identifying then is chimeric reads, so again, regions of the virus that match up to regions of the chromosome 14 of the human. And so with those coordinates, we can look at the bionano data to look at the structural variation event. And we can see that denoted by the red arrow is where the virus has inserted itself into the genome. And then the red rectangle then shows where this new insertion and the region around it has been duplicated twice. The last example here is a tonsil cancer, again showing that many structural variations on Circles plot from bionano. And so, consistent with previous examples, then we would expect to not detect any chimeric reads on a whole genome sequencing. And as what we see good mapping overall to the HPV16, but no chimeric reads, so it does not suggest integration. So again, we suspect episomal for this subtype. And we've done this on additional patients, and this pattern holds true. HPV integration is associated with many structural variations on bionano data. We go to whole genome sequencing, and we're able to detect chimeric reads, showing the integration site for the virus. When we see a lack of structural variations on the bionano data, then when we go to whole genome sequencing, we see a lack of chimeric reads, and so then it's consistent with episomal. So because the episomal HPV cancers don't have any structural variations with bionano data, we can then ask what drives these cancers. And so we're further looking into whole genome sequencing, SNP analysis. We've identified some genes so far related to DNA replication, cell growth and division, and RAS pathway regulation. So looking now at some clinical information. We have data on 7 integrated HPV cases and 6 episomal HPV. Integrated HPV cases have more aggressive pathologic staging of their cancer. They're more likely to have cancer recurrence. They also have greater mean tumor size and size of largest metastatic focus within the lymph node. Integrated HPV cancers also have a greater association with perineural invasion, meaning the cancer has evaded into the nerve, and lymphovascular invasion, meaning the cancer has invaded into the lymphatics and blood vessels, both of which are associated with worse prognosis. So overall, we can see that the integrated HPV oropharyngeal cancers have more aggressive cancers than the episomal forms. So in conclusion, optical mapping with genome imaging is able to construct complicated genomic alterations that were previously unidentifiable using whole genome sequencing alone. Optical mapping with genome imaging from bionano and whole genome sequencing from Illumina can detect the state of HPV genomes in head and neck cancer. Integrated HPV head and neck cancers contain greater genomic instability and correlate with worse clinical outcomes. Integration status of HPV may become important for cancer treatment planning in the future. I'd like to thank my main mentors, Dr. Broach and Dr. Goldenberg. Thank you.